for you.
Okay, go ahead, record it now.
Okay. So how can I get the little screens out of my thing so I can see my presentation?
You swipe it.
There's a way to do that. You need
Oh,
to
sure. Um,
click on it. It might go away then.
Video profile chat stop video pin. No.
I thought I put Stefan the handsome face to do all these things and
How
start
can I?
everything. And I don't want to put my face. I mean, we have a handsome face bodybuilder. He's wearing. Why are you wearing your shirt, man?
It,
Oh, I was able to do it. Hey, good. Okay. So
okay.
perfect. So at least I have most of my slides. Okay. So I just created something. This is the Dr. Halasta got me into AI, or got me to somebody help me with AI. So I just made the first picture. So I wanted to have the okay. Hi everybody, it's Dr. Barr. We've been chatting earlier. Sorry. But I created a cell with a nucleus and as the DNA, and then I'm trying to reverse the time. So I just created this with AI yesterday. Anyway, so the topic today, we're going to be talking
Wow.
about peptides in clinical use. And I usually use my peptides mostly for my longevity anti-aging program. They're great for, of course, metabolic and chronic inflammation. And most of you know that peptides are amino acids that are linked together, and depends on the number and the size of amino acids. That's where they would make a peptide. And if they're large enough, they would make a protein. So today I'm going to be discussing some of the clinical applications. When were they discovered? Why were they discovered? Are they safe or not? Are there clinical use studies for them? Because everybody now is saying don't use peptides. There's no human clinical studies. They're not FDA because they were not studied enough, and there's no clinical and peer-reviewed data. But I'm going to show you through the history that these have been used since the last century, and on thousands and millions of people. And I'm going to discuss some of the common peptides, and I'm going to leave open discussions so we can talk about any kind of peptides we want to talk about. So the history of peptides goes back like to really medieval time. They are mostly amino acids, and that's the origin of it, that were derived from animal organs. So the organs, have been pulverized or put into as capsules, or kind of people ate them because they knew there's benefits, whether it's a liver, where this has happened like over the years in so many cultures, and there's values. Even the Chinese have done that. So there are 52 animal extracts that are produced that are documented even since the 19th century, the Ottoman period, which is where I came from. Yeah, Dr. Halassa. Anyway, so peptides are bioidentical to our cells. They are made in our body. They are natural occurring. We know that. And they have a function. They are sensitized through translating messenger RNA and into hormones, enzymes, antimicrobials, signaling proteins, and they're very essential in our daily life. We cannot live without them. They're not just discovered, and the hype just happened when the Kardashians and Elon Musk tweeted about them. So people are more interested in them now. So peptides are typically very small molecules of amino acids. They are proteins. So they bind to the receptor. This is an example of the GLP-1 and all the cascades of things that can happen from there. The molecules have a wide range of actions. So one peptide can have a variation of actions that's very common, and they can impact various biologic functions. They can affect the endocrine, the immune, the nervous system, and they usually regulate the genetic expression depending on their size. So they either have a cell signal on the membrane to trigger the cascade, or when we talk about bioregulators, they become, somebody needs to admit Scott. Okay. They become kind of like molecules that affect our nuclear, messaging. So they manage various cellular processes. I said most of it like growth factors, stem cell activation, hormone regulation, mitochondria, neurotransmitters, microbial effects. There's so many functions that I think that peptides, or thousands and thousands of them now, are identified in the clinical field that we can use them for our patients. And they're not something that's new. The typical side effects are very rare. They're very safe. They've been used for thousands of years. And I'm going to go through the history of that. They can cause desensitization, their proteins. So as their proteins, we have to inject them. And when they inject them, that can create, a desensitization and allergic reaction. They increase cortisol sometimes, or prolactin, especially the growth hormone releasing hormone ones, peptides. Theoretically, they also increase the risk of cancer. So definitely, and JHK should be on this one too, because of the angiogenesis. So TB4 is one I don't use, frequently, unless I'm sure my patient doesn't have cancer, because it grows tissues. For sure, all the growth hormones that we did not want to use before, it was a big hype, years ago, to do growth hormone for anti-aging. But now we know that the growth hormone peptides or analogs are much better, because again, you're not triggering the whole cascade, IGF-1, growth hormone releasing hormones. All these are better because they would focus, for example, maybe on muscle building or certain things that the patient's looking for. And then you can cycle them and you can pulse them. So they're not as, inducing cancer like your growth hormone. That's the theory. However, that the risk is still there. Also, dihexa is another one we were just talking about, that it's good for brain health. Dihexa has the risk of hepatic growth factors, growth of tumors, because it's a hepatic growth factor. So despite the safety, and they've been used for long periods of time, I think the patient should be monitored by a physician. And I usually check all my patients I do the early detection for cancers, and I do my IGF-1 and IGF binding proteins levels before I take anybody and put them on any peptides that is a growth hormone. So the history of peptides is pretty interesting, and I just wanted to talk about this because not many people know about it. It started with Robert Freitas, the one down with the mustache right there. In the last century, he started the nanomedicine kind of movement. He wanted to, and he was like trying to create a way of applying medicine at the molecular level, which he wrote books, and he was very much involved in that. So that was the original kind of concept of that. Instead of having a large molecule or surgical intervention, you're dealing with something like 1/billionth of a size. That's the little molecule in the center there. And that's like equivalent to like 5 carbon molecules tied together. So it's very tiny, and it can work on a very small size inside the cell. So this was followed by, like, again, the last century, the Russians at the same time were trying to figure out how can they work on defending themselves against this atomic bomb, and finding how that their soldiers were aging. They're in submarines, they're exposed to radiations, they're finding that these soldiers, because of that exposures and because of them being in submarines, trying to be close to us just in case if they're going to trigger a reaction, they decided that the government, they're going to fund a project, because two things. One, they thought we are gonna attack them and we're coming up with something to destroy their vision. That was the rumor. And the other thing is, like, all these soldiers were exposed to these radiations, and they were all of a sudden getting premature aging. So the Russian government, in like last mid-century, assigned Dr. Kavinston, which is down there at the bottom. And he was a physician assigned with the army. He got into the army to treat this problem of premature aging, that they found all their soldiers exposed to radiation and being in submarines for months and months. They were starting to have aging of the pineal gland, of their cardiac vessels. They were having infertility they were having vision issues. They were having problems with their cognition and an immune system. So these are the things he started to try to figure out. And thing that made him look into it is that he started researching animals. So they worked on calves that were, I think, raised somewhere in Europe. And they got those calves and they harvested their organs and they started injecting these organs, if like pineal or cardiac vessel, lungs. And they started injecting these soldiers with these products, and they have been getting great results. So Chernobyl happened after that, and they were the people that went out there, those Russian scientists that went to treat for Chernobyl. There was another explosion. I don't know if anybody remembers that, a major submarine that was exploded. 40 soldiers were submerged, and then one of the radioactive submarines, and they were able to save them and even reverse their aging. One, they were testing their mice because they also had a lab where they were doing animals. The mice that they were injecting them with those organs, they found that the mice that they were old started becoming fertile and impregnate and have babies for the other mice or rats, whatever they were testing. So it's not unusual to say that thousands and millions of people have been tested. These are like the human trials that we haven't heard about. And all these things were patent and secret by the Russian army. So this is what we know about peptides. The Greek word meaning like it's digested, it's short polymers of amino acids, right? Again, these are proteins. Most of those are less than 50 amino acids together. The bioregulators that Dr. Cavenson has worked on were 2 molecules or 2 amino acids or 3 amino acids. And that is very important because bioregulators, we know now that they could be used orally. But if you take a peptide by mouth, it's going to be digested except like BPC because it's created in the gut. So BPC is the only peptide that does not get digested as a protein. However, bioregulators, because they're 2 and 3 molecules, have been very potent, and they can go down not on the cell membrane, but they can go intracellular and work on the nuclear level. So that was the thing that I found that's pretty interesting. A lot of these, kind of publications and work has not been published. However, it was also like very secretive by the government until the end of the century. Dr. Cavenson died, I think, 2019. He had a lot of patents on his products. These are the true original, I want to say, peptides or bioregulators because they're smaller peptides. And they were able to work on thymus, reverse the aging of thymus, reverse the aging of cardiac and vascular, neuro, and vision. And I'm going to show you some of the things that they've done. So this is Dr. Cavenson with Putin, who actually supposedly gets his products. And that was his forecast that in the next 10 to 15 years, peptides are pharmaceuticals. And at the end of the war, he opened or worked with an institute of gerontology in St. Petersburg. And then they started treating people even in Europe. And they started collaborating with other institutes and universities in Europe mostly. However, the Americans thought, oh, we're gonna come up with something like peptides, but that was already like researched to death. So this is one of his famous articles or the first peptide that he came up with, like the pineal gland and the thymus, that he put them together. And he was able to reverse the aging for patients, and it's a very common one, and it's even used as an oral peptide, or it's over the counter and is sold in Russia. But that was like, again, they tested people for 6 to 8 years. Now they're dealing with civilians. He had his Institute of Gerontology. They work with a lot of patients, and he's got a lot of proof on what he has done with his peptides and bioregulators. So This is one of his studies showing like elderly people, and I like how they say old people, the 75, 80, like it's very blunt. But they were able to use just with the pineal gland, work on reversing the aging. And then on the bottom one, they have using both pineal gland and thymus, they were able to reverse the aging of the organs. This is also, that was a big study that they did for their, I think they were welders, over 3,000 cases, and they find that they were able to reduce their mortality. And the control groups that were given vitamins instead of capsules, because these are not injectables, right? And the other thing that was very significant, they were able to reverse their lung diseases and improve their acute respiratory situation there by 2.7 times and 2.3 times, which is pretty interesting. Russians are pretty kind of like more advanced in retinal and vision fixing, because they thought one of the rumors was the Americans were gonna do something for them to get them all blind or something like that, including their like, worries about the nuclear reaction that would happen if we send our nuclear bomb there. So they're very advanced in vision as well, like or retinal peptides. And they this is like the retinal scan, and you can see in the beginning this is a diabetic retinopathy, and then you can see the green part that this has improved the vision, which is huge. And these actually, I just want to say, like, these bioregulators or peptides are available now. I've been using them in my practice, and they're oral, and you can buy them now. Actually, they were at A4M recently. I'm just saying these are oral, like oral food supplements, which is great, So anyway, anybody can get that. They also help with macular degeneration. There's other ones I didn't add here. And retinitis pigmentosa, which is, again, if somebody has retinitis pigmentosa, there's no cure for it. But these oral peptides, which are considered like kind of supplements, are amazing because they have clinical effects that. So these are oral, all like kind of things that people can take by mouth that they're using in Russia. So the things that they started testing recently is methylation, DNH, and also telomere length. And they also have clinical studies that are in Russian, if somebody can translate. But this is interesting that they can actually show people just on epitalin, which is the pineal bioregulator or peptide, pineal and thymus bioregulator. These are the only two peptides that we're using in these. They can reverse the DNH, which is a test now we can do for our patients, right? And the non-peptide subjects were taking vitamins. So it's not like it's a double-blinded kind of thing. Nobody knew what's going on. Other clinical studies that they have done, again, they used it on employees for that factory, and they were able to improve blood vessels, liver, kidney-like functions just by taking these peptides or bioregulators orally. So this is the history of peptides, and it's just like I always hear people talking about it, like in the Western medicine, there's no background, there's no research, there's no clinical studies. I think there's millions of people that have been on peptides and they don't know, or they know in this country, but also like by eating animal organs, but also in different countries, they have done so many testing on their subjects without, having these publications. So peptide therapy is used in everything. And there are several FDA clinical studies that are running. And then when we get one peptide like BPCs off the market, or PT141, a peptide that now they're trying to use like for libido, whenever they take them off the market, or thymosin alpha was used actually during COVID, we know that they're becoming, pharmaceutical drugs, and it's just a matter of time. So there are FDA studies that are ongoing for peptides to become drugs. We know GLPs are some of those, and they were like revolution for our weight loss over the last, 3 years or so. Once the celebrities start talking about them, and they're going to change the weight loss industry completely. Until now, they're becoming banned by the FDA. We'll see what happens. So peptide therapy could be used for longevity. I use it for longevity. For health maintenance, that's what the Russian used it for, reversing all this infertility as well for their soldiers, because they were told, like, fix those soldiers and bring them back to war. Muscle health and sarcopenia, one of the peptides now is it's kisspeptin, I believe, is used for HIV patients for sarcopenia. Weight loss, which we've heard about the GLPs, there's some of them are used as vaccines, some are used for cancer, like thymosin alpha, for example, and there are others. One of them is actually being used in oncology. A lot of aesthetics. We know that the peptides, when you Google peptide, it comes out like peptides for the skin and for the hair. But now we know that they're beyond that. There are peptides for kidney functions, like BPC, for example, is great for kidney function. Cardiovascular, like the SS31, for example, is a great one, and MOTS for cardiovascular. Mitochondrial, the MOTS, SSR, humanin are mitochondrial peptides. They're neuropeptides. I love SLENAC and dihexa. CMAX is really cool too. So CMAX is really good for also anxiety. And so those two peptides, they can kind of replace Xanax, natural Xanax. Muscle and muscle injuries at the end. BPC is an amazing one. MGF is a muscle building peptide. TB4 we use for that too. GHK helps with vascularity. Here is missing, like, for example, sexual health peptides. I use gonadorelin instead of using HGH, for example. That became limited. So gonadorelin is a good one to stimulate testosterone, especially for young men that I do not want to give them testosterone. I use gonadorelin. So they're mostly injectable. I'm going to talk about some of them here, and we can discuss more. There's a lot of clinical trials, as I said, and more than 60 are FDA approved so far in clinical use. There's, again, signaling proteins. They work that way, and I guess we've already talked about that. A lot of them are pleiotropic, meaning that they would have different functions. So one peptide can, like, for example, semaglutide is a great, improves insulin resistance, improves your sugar metabolism. It's great for fat metabolism, but also it's great for anti-inflammatory. I think there are studies like for kidney effects. So they have a lot of pleiotropic effects. And the other common thing that they all have is that they have a very short half-life. So they're signaling. They go create a signal, and the signal goes in and does a job. And they create a rapid cellular response. Most of the injectable peptides have a fast response. However, the bioregulators, they have a slower response. And that's why when they did their protocols for bioregulators, you would take them for a month and then stop and take them for another month, and then you take them for 3 years. And that's when you will start seeing, like, the DNA methylation drops and the telomere length is improved. So peptides, that's the pleiotropic effect. For example, I will give an example of here, MSK, for example, the muscle peptide. Musculoskeletal peptides would be like BPC, TB4, CGC, epimorlin, AOD, copper, simorlin, neuropeptides, I mentioned them, cerebrolysin is here, SNAC, CMAX, PPC, has a neuroprotective effect. Melanotin, too, has also cerebral effect. So most of them have more than one. These are very common for my anti-aging protocol. the HGH peptides, the GHK, it modulates the signaling on the DNA and helps the telomere length. BPC is great for inflammation. MOTS is mitochondrial. The dihexacerebrolysine TB4, I don't use it as much, but TA1 alpha, yes. So the clinical use of peptides is in infancy in the Western medicine. So most of your Western medicine docs, they do not know much about peptides. And they think most of the studies have been done in mice, but not in humans. However, there are over 400 clinical studies that are out there that a lot of them also are, you can do Google Translate at this point. The way they're synthesized, we were talking about this earlier, there's a solid phase. So the injectable peptides are all synthetic, even though our body makes them natural. And as we age, like hormones, we make less. So all your injectable peptides are synthetic. However, the bioregulators could be synthesized. That's what they did at the end of the last century when they opened their center in St. Petersburg, and then the 3D computers and the technology improved, they were able to analyze those animal organs and identify the peptides. So these peptides were identified to the one or two molecules of amino acids, and that's what they synthesize it, and now they can put in a capsule and still sell it as food. However, they still pulverize those animal organs, and then I would say they would have more other things like cofactors, and they still put them in capsule, and they still sell them as a food product. So there's two types of bioregulators. One is synthetic, and one is pure organ. The other ones that we do inject them now are mostly synthetic, and there's a machine that just puts one amino acid next to the other. It's a process. It's either through a solid phase or a liquid phase. And liquid phase, a lot of the pharmaceutical companies uses that. Goal is to improve the properties of the peptides, increase the longer half-life, higher bioavailability, increase potency and efficiency. And that's what they're doing with your Ozempics and semaglutides and so forth. So that is probably the future of peptides. They're going to be all synthesized, and they're going to be in the market as drugs, I would say, as pharmaceutical drugs at some point. How can we give peptides? I guess they are very sensitive. They're amino acids. They can get denatured. So you got to be very careful. You don't want to mix them together because they have charges. They could be used sometimes transdermal. So some people have used them transdermally if they're small enough to pass. Intranasally, so we do PT141 intranasally. We've used Slinac and CMAX intranasally. BPC can be given intranasally. I don't know about pellets. I haven't used them, but you can also do them sublingual or oral. However, I'm not sure about the oral. There are new technologies coming in so that the body does not digest it through the acids because it's a protein. I'm going to talk about some peptides. I'm going to talk about some of the longevity and senolytic peptides that I use in my practice. One of my favorite ones is the MOTS-SC, mitochondrial. So I'm going to say what they are, and then we'll go through one by one as much as we can. So MOTS-SC is a mitochondrial peptide. Humanin is another mitochondrial peptide. SS31, FOXO4-DR1. I like to synergize those with the NAT for mitochondrial function. Epitalin. Epitalin is a bioregulator. That's what Dr. Cabenson worked on, but we also now can have it as an injectable peptide, and we use it for patients for anti-aging. So mitochondrial peptides, I'm going to talk about human and mods. They're very important for us because they affect our lifespan. There's a lot of work and studies working on how the mitochondria affects our aging process. So I'm going to talk about those two here. The first one I'm going to talk about is humanin. So this is important because I think that's humanin, I guess. Yeah, didn't put a title there. the mitochondria regulates several things, right? So on the cellular level, respiration, right? The mitochondria is not it's an organelle that we got from a prokaryote. We all know that. It's inherited through the mother's, like side of the, inheritance. So again, the mitochondria is very important because it regulates our respiration, apoptotic signals, reactive oxidative stress that could be good or bad. So in a small amount, it's fine, but then it can overboard and can create damage and create oxidative stress. So the mitochondrial function declines with age. And we know that the mitochondria affects longevity. So it's one of the hallmarks of longevity. Do you all remember the hallmarks of longevity? There are 13 now. One of them is mitochondrial senescence. It influences the type 2 diabetes. It's involved in neurodegeneration and, of course, malignancies, which is another one big thing. So I guess that's not a peptide. So this is the humanin. So humanin is a very interesting peptide that was discovered actually by 3 scientists the same time. It was cloned by 3 scientists. One of them is, here in the US. And actually, it was interesting because they were discovered in the brain. And I think it's Alzheimer brain that they were able to discover that humanin protein or gene, right? And so that was interesting. And humanin was found to work on several things as well. So it's a small peptide, it's 16 amino acids, and it affects the brain. It was found in the brain, testis, and it is a very interesting peptide because it is also very much involved with our aging. So it downregulates the growth hormone. So that is one thing that is actually, these are studies in humans and mice, both. And also it's very important for the brain. So it's been discovered in the brains for Alzheimer patients. So this is interesting work that has been done. Humanin also reduced in patients with endothelial dysfunction. This endothelial dysfunction is a rat, I think, or a mouse, but you can see here the endothelial dysfunction with humanin being used if it's poor amount of humanin or normal amount of humanin in the plasma. So endothelial dysfunction is big humanin. So that's why blood vessels are very important for aging. Now, the other peptide that's mitochondria peptide, which I use a lot in my patients, is MOTS SC. It's amazing when people take it, they just feel a lot of energy and they feel great. Um, this is one of my favorite peptides because those who do not want to go to the gym, it is an amazing peptide for that. It's a small peptide and 6 amino acids as well. It affects the insulin resistance, can reduce obesity. But my favorite part here is that, well, this is the increased glucose utilization, metabolic function, insulin sensitivity, improves mitochondrial function. But this is the study that I love, that it's an exercise mimicking peptide. So those that take it and do not want to go to the gym, look at that. They're still gonna utilize their sugar, and it mimics the exercise state. So I love that for this. So this is the again, the bars they're showing like the young people with the MOTS, and then the age one is in the middle, and the age with MOTS. That's the glucose uptake. So it enhances glucose uptake and it mimics the exercise state, which is cool. So they also found that in a study, I think this was in here, mice, that the mice that ate a high-fat diet, which is the very red up on the top, below that was a high-fat diet with MOTS, and below that is normal diet and fat, whatever, like the normal diet and normal diet with MOTS. So you can see how it affects that. Really cool. Even with eating fat, you can see it has a great effect. Mitochondrial effects on senescence. So the MOTS is one of the peptides that also has been affecting senescence and measuring all those inflammatory markers. So IL-6, IL-1 beta, IL-10, all those tumor TNFs. So it can have a role on these cytokines. I've used it during the cytokine storm that we all had to deal with. SS31 is another peptide that is by the mitochondria. SS31 is antioxidant peptide. It is a really powerful one. It protects the mitochondria itself, which is very important against its dysfunction. So it's an antioxidant peptide. It helps with the cardiac. So I use SS31 for my cardiac patients because it's one of the muscles that get affected. It has a lot of energy consumption. It helps with infarct patients, reperfusion. Again, these are studies in rats, but I've used it on patients. And next one is, also it works on mTOR here. It's a really good kidney peptide as well, I guess. One of the ones that we've used in the kidneys with BPC. So that's a once a week dose. FOXO4, you got to be careful with that. I usually get the patient through a full protocol before I give them the FOXO4. It targets apoptosis. Somebody was talking about sirolimus or rapamycin earlier. So targets apoptosis, that's senescent cells, and restores the tissue homeostasis is very important. So with most of my patients, once I put them on an anti-inflammatory diet, balance their hormones, immune kind of senescence correction, mitochondrial repair, anti-inflammation, of course, lifestyle, fixing their lifestyle, detoxing from heavy metals, all that stuff. Then we take them to the stage where we improve their apoptosis and target their zombie cells. So FOXO4, and before using FOXO4, I use apitelin with that. So FOXO4 and apitelin. FOXO4, you got to use it with caution because of the P53, but it's a great one for autophagy and apoptosis. So I'm going to talk a little bit about aging and the loss of hypothalamic function, the releasing hormone. So as we age, of course, the hypothalamus loses its function, and the senolytic program that we use for the preserving the growth hormone axis is usually using the analogs. So I use sometimes growth hormone releasing hormone peptide that we can use now, and it has a lot of positive effects on anti-aging. We measure the patients before we get them started any of that IGF-1, BP3, we do like binding protein 3. When we're putting them on any of that stuff, we do like early cancer detection. We don't put them on them right away without testing. There's a variation of them, multiple that are on the market or available. A lot of them are very short acting. The longest acting one is the CGC, and sometimes they add to that epimorelin to it. So as a combination, a lot of the people who want to build muscles, they're on one of these, and we rotate them. Most of the time we do not, we tell the patient, just please do not have a meal, have them late at night, if anything, to mimic the growth hormone release if possible. Occasionally we would just make sure that they're also taking them before exercising in the gym or during, just before the gym or after the gym, because that can help build muscles. A very common one is the CGC epimorelin or sermorelin, and they improve the NAD and NADH ratio. They decrease the inflammatory markers. So these are one of the most commonly used ones, CGC epimorelin. It's been on the market for a long time, or people have been used it for a long time, even before the hype of peptides. We got to be measuring the IGF-1 and monitoring that. They also have been used in building muscles and weight loss. So I use them for the people that came to do the semaglutide. I would say, why don't we just prevent your muscle loss by adding one of your HGH peptides in if you are low. They improve the energy level, of course, and people love those because they just take them at night and they sleep really well as well. The only caution, as with these is that you can increase cortisol. So you want to measure your cortisol levels. When somebody wants to get on these, you want to make sure their cortisol level is not high because that could be increased. Generally, before anybody goes on peptides, I do a full panel of labs. They just do not go get them like buying them online as people do right now. So the difference between CGC ipamorelin and tesamorelin or epamorelin, that's why we combine CGC with epamorelin, right? One is a releasing hormone and one is an analog, right? So that's the difference. And they both would increase your growth hormone. However, I have not yet to see anybody with very high levels of growth hormone. Like when you send patients on growth hormone, sometimes they cheat and you have to measure and remember when did they get it and the prescription, did they take overdose on it, because they tend to do that, especially those bodybuilders that want to do more. So I've never yet to find anybody on very high results on their labs for the growth hormone. So it might increase it 30% or something, which is nice. And then when you stack them with other hormones for muscle building, patients love that. So again, I think I talked about that real quick, but they have a very short life. They increase muscle mass, decrease body fat. They're great for memory and cognition. So that's another one that we were talking about, memory and cognition. It's anti-aging. They increase the bone density and increase skin elasticity. And people do look younger when they're on them for quite a bit of time, like a few years, then you can notice the difference. I'm going to talk about immunopeptides. The immunopeptides are thymosin alpha is one of my favorite peptides when I want to immune modulate somebody. So, and TB4. I use TB4 less than thymosin alpha. Oh, I didn't talk about them much. So thymosin alpha, the bioregulators that the Russians created, the oral ones, was from the thymus gland. So now we created the thymosin alpha. Also, it's a thymus peptide. It stimulates your T cells, your B cells. It is a great immune modulator. And we've used it antiviral, antibacterial. So it's like a wild card instead of an antibiotic. And it's pretty safe. It's short-lived. I've given it sub-Q and IV. And TB4 is used for viruses. It stimulates growth. I've used it as I want to combine it, like, for example, with TB4. That's the Wolverine. We all know that because it potentiates other peptides. So also it can increase the proliferations of cell. So that's why you're going to be careful with cancers. So these are the two immune peptides that we usually commonly use. There's a third peptide I didn't add here is LL37. That is really an interesting peptide because it's really great for antiviral and antifungal. We've used it for fungus and yeast and stuff like that, and mold. Kisspeptin. So I don't know why it's there. It should have been up. Okay. So hypothalamus, another one, hypothalamus controlling peptide. And it is I like the name KISS1 gene. It's a neuromodulator as well, and it's sensitive to sex steroid feedback. So it's another one that I would use for young men who are wanting to do testosterone coming for that, and I don't want to give them testosterone because I don't want to suppress their spermatogenesis. So we use kisspeptin. It is recognized as also an important sex regulator for puberty, and kisspeptin is testosterone booster. It increases the LH and FSH, so by 2.5. Fertility is something that we've used it for patients that were on testosterone for a while and then they wanted to get their fertility back. So I've used kisspeptin with HCG, or I've used kisspeptin with Clomid, for example, to try to bring that back for their sterility that happens with the suppression. It's great for libido and mood. It is also a very important one that we've used for glucose homeostasis. And there is a synergistic effect that we've used it sometimes with GLP-1s for fat burning and glucose homeostasis, especially glucose homeostasis. And, females get that too. So it's not only like females need testosterone as well. So it's not a male peptide. It can be used for both. And then you can pair it with HCG and clomiphene for fertility. I said that. It may enhance MGF indirectly, muscle growth factor. It's another cool peptide that I use for muscle building, MGF. I don't know the name of Maggiano something growth factor. Gonadorelin is another peptide that I use for men mostly or females that are looking for increasing their FSH and SLH. So mostly men, especially that are on testosterone and or that are on testosterone that I would want to use it instead of Clomid, or I would use it if we want to, prevent those young men from taking testosterone. I say, why don't we put you on a peptide like gonadorelin and kisspeptin? And usually I pulsate those as they should happen through your hypothalamus. So they're not usually given daily, the gonadorelin like HCG. Very common peptide that we know is, I had a big bar in front of my screen. Okay, it's gone now. BPC. We probably all heard about BPC. It's one of the popular second search peptide on Google. BPC is combined with the TB4 to be the Wolverine. So as the name implies, it's used in healing and repair and recovery of injuries. So you can actually heal tendons, ligaments, muscles, and bones, which is there's nothing like that. Also, it works on collagen formation and supports fibroblast activity. It stimulates the healing process through also impacting some growth hormone activity. So this is a really great peptide. I use it a lot injected even in joints. It could be injected directly in joints, or it can be given subcutaneous. BPC, a peptide that was discovered, supposedly told with Pavlov when he was using the animal acid gastric studies. So it is the peptide that's secreted in the stomach. And when taken orally, this is very interesting. So BPC, when taken orally, can heal the gut. It's used in inflammatory bowel disease, Crohn's disease, anybody who had major gut problems, SIBO. So for healing the gut, BPC 157. It's also a great anti-inflammatory. So that's another big function. You can use it combination if somebody has rheumatoid or you want to reduce inflammation, you would use BPC in longevity programs. I stack it. And also it's a neuroprotective peptide. There is clinical studies on that. So BPC was one of the old peptides. There's a cool history about it too in Europe. It was discovered by the Croatians. They've used it they've used it in various tissues because it helps blood vessels formation, angiogenesis, growth, and repair. And the Russians have used it with their gymnasts, and I think the Croatians too. But I think the Russians are the ones that they use them on their Olympic gymnasts. Actually, there's pictures of Kazakhstan with all the Olympians. So all the Olympians have used the bioregulators because they're considered food or supplements, right? But they were using BPC on those Olympians. They fall and you see them, dropping one day or in competition, and next day they're showing up and going for the medal. So it's interesting. So they're pretty popular for joints, tendons, muscles. If you remember, one peptide today is my go-to whenever we have any injury or anyone who wants to improve their muscles and joints. Oh, here's thymus and alpha. Okay, I guess it's back. It's thymus, and it is used in autoimmune, thymosin alpha. They decrease with aging. So we know the thymus is rudimentary by 30 or something. That's why thymosin alpha is decreasing with aging, right? So unfortunately. So it promotes I said that Thymo1 and Th1 and Th2 balance, T cells, B cells, enhance immune tolerance, Treg cells, amplification, increase the natural killer cells. That's why it works on viruses and cancers and T cells. Thymosin beta, health and growth. most abundant thymus peptide. It helps with wound healing. So if somebody gets a burn or a cut or something, you can pour some of that on their skin, especially burns, and it heals. Activating stem cells, that's why we worry about it for cancer, right? Anti-inflammatory, antimicrobial, longevity, slow senescence cells, but you got to be careful they don't have cancer, and apoptosis, and one more person coming in, admit, and immune modulation. JHK, copper peptide. So this is a popular peptide for skin and anti-aging. However, we know that it does more than that. It is very much studied, even here in the United States. It's a regulator for the human genes. So it's a very important gene for longevity and anti-aging, and regulates the telomere length. So I guess the DNA repair is one of its functions. So IGF-1 and JHK, insulin, IGF-1 and JHK receptor. Again, it signals that receptor. Epitalon, this is a bad slide. So epitalon is another peptide that I love. Cavenson has discovered that. It's the pineal regulator, pineal gland. Pineal gland is the teeny small gland in our brain that regulates all your melatonin and your circadian rhythm and all your hormones. So it's very important. Epitalon can stimulate DNA, mRNA, and then produce proteins for differentiation and proliferation and apoptosis. So that's why I use it for my longevity before the FOXO4. Epitalon is amazing. It's one peptide that they've used with the thymus peptide for reversing the aging in the Russian studies. Improves insulin resistance, which is the problem with all the inflammations that we have right now, right? Decrease LDL and VLDL, improves tissue repair, anti-tumor effect, decrease mortality and life expectancy through, again, measured telomere length expand. Like within 1 year, you will find, if you're testing your patients, telomere length will change. However, DNA methylation will take some time. So it might take like 3-4 years for DNA methylation if you're checking that, the DNA age. But if you're doing telomerase or telomere length, you will find that it is really affecting it right away and within less than a year or 1 year. So epitalon is one of those very short amino acids. That's why it qualifies to be a regular bioregulator, right? So 1, 2, 3, 4 molecules are bioregulators, and it regulates the cell cycle because it goes down to the DNA level, right, to the DNA. And as synthetic tetrapeptide, that's what it is, and it comes from pineal gland. We talked about that, discovered by the Russians. So this is a summary of most of the peptides I use in my practice, and probably I've added to that. Thymosin beta, TB4 frag, BPC, KPV, I haven't talked about it. KPV is a really great anti-inflammatory peptide. I just blogged about it. It's one of my go-tos when anybody has inflammation or injured joint. I usually give them extra with the BPC, KPV. I sometimes add TB4. Occasionally, I would do a pentosan. Thymosin alpha is the immune modulator that I go to for everybody who is sick. I treated all the viruses that we had previously, even the viruses that we know now that are in, dormant viruses or long kind of haulers. I've used it for dormant viruses like CMV, EBV, protocols. I've used it in mold protocols. Thymidine, Thymogen, you change the name because the FDA keeps on changing. You can't do this one, you can't do that one. So they take a different frag. Epitalon and pinealon, they're the same, the pineal peptides, whether it's a bioregulator, injectable, or a synthetic. Sleep peptides. So epitalon is a synthetic and pinealon is the animal organ. Sleep peptides, epitalon and pinealon, they regulate the melatonin in your circadian rhythm. I don't use this DSIP anymore. CGC epimorlin is one. Sometimes I use it in combination, maybe for the first time, but then I've started using Kisspeptin, Tesamorlin, much better than that. Or Simorlin, I've gone back to the old one. AOD or growth hormone releasing peptide. That's another one that we can use now. Or IGF-1 frag. So AOD is a really good peptide that you can use for weight loss. It's a very short acting. So if you use it with the GLPs, you just do it the day they come and take their injection. So it's just for one day for a few hours, but it helps with fat metabolism and it does not control the appetite as much. So that's the difference. Brain peptides that we use very common: CMAX, Selenex, Dihexa. I'm just summarizing: cerebrolysin, and synergistic with the epitalin, I would use TB4 and KPV for inflammation, or BPC for the brain inflammation. Growth hormone secretagogues are we use those fragments right now. They can make them through the lab. And I think this is my last slide. What do I do now? Anybody there?
Yes, we're here.
Okay, I'm done. I talk too fast.
It's a good time for Q&A.
No,
Yeah, it
it's
is.
very
Yeah, we
good.
can talk about any peptides.
Dr. Iman, we
Yes, sir.
can write a book on this. You send me the word of everything you have in the form of a word. I will put it in the AI. I will spice it with CDP MCS protocol,
Yeah.
and then Sheldon and Jeremy will work in expanding it, visualizing it, putting reference there, and make a 300-page book out of it.
I have more peptides. I just didn't want to put more. And then honestly, yesterday, the whole thing went out and I had to do it on PowerPoint, my computer. So this was the first time I used PowerPoint, by the way, guys. The
Yeah,
first time
Jeremy
I
great
has
used
job.
the PC version.
It was very good.
Thank you.
Good. Yeah,
So Steve Horvath said if I don't know if you guys see, can you see my screen still?
yes,
No.
yes.
Yeah.
Is it slides or what is it now?
It's
Is it
You
slides?
just go ahead to do it. Yeah, click on that.
Make it bigger? I don't know how to make it big.
Click on that. Click on.
Okay.
No, not that one. This one. Where's the show?
slideshow.
Yeah,
Slideshow.
slideshow.
See,
Hmm.
it's in the same row as home.
Oh. Hmm.
Just go to the right.
Anyway, I just can't. You are using enhanced share participant. I don't know. But I'm open for questions if anybody has questions. I don't know how to
Well,
get record view video panel. I can't open the slides again.
You just you get to home and
there you go. Now you can click on slideshow.
Where is that? Sorry, I don't know where that is.
Okay, you see where
Oh,
home
yeah.
is?
Okay, this one. Right?
yes.
Yeah.
Okay. I was gonna get so I have other peptides, but why don't we talk about peptides? We'll just anybody has questions?
Well, my first question is, what type of results are you having with your patients? Is everything doing really well? Some better than others, some people better than others. Does a lot of it have to do with compliance? All those general things that how you're helping people would be my
Yes.
question.
So I've started using peptides, I guess maybe it's 3 or 4 years now, maybe 5. I don't know. I went and got the peptide program with the A for M. Then I started going into all these conferences and learning more about it and digging more. So, I think applying peptides on my patients in the beginning, maybe I would have 1 or 2 peptides. Now, most of my patients are on 4 peptides, if anything. And I take them through the whole process. So it's very important, as Dr. Halasa says, I can throw peptides at anybody, but if they're inflamed, if they're not, eating healthy, if their lifestyle is messed up, if they have a lot of reactive oxidative stress and their blood sugar is not balanced and their hormones are not balanced, I really take care of all these things. And so I just don't want to throw away good money on bad, right? Because if they are just not in a good, healthy state, I don't want to give them growth hormone, right? I'm just going to grow bad stuff. So once I balance all their hormones and reduce their inflammation, so I take them through those stages. And then most patients now they're vested. So I don't have people who don't do well because you're combining, honestly, I think they're the miracle drugs. The only thing that I've seen that's not good is that number one, it's expensive. The number two, very occasionally, I would get a patient who has a reaction from CGC epimorlin. When I was doing the weight loss peptides too, a lot, it's a problem because that's unfortunately, I don't like it because I say if I'm going to give you a weight loss peptide, if you're going to be on any of those peptides, you really have to take a muscle growth factor. You need to increase your protein. You need to be on collagen. You need to take that diet. You need to take it serious, right? And I won't put you on you start maybe for a month or two, reach what you want to be, and then we microdose, right? Most people are doing that, which I've done it a long time ago. So I put them on maintenance. I used to call it maintenance. People are calling microdose right now, whatever, like mushrooms, but it doesn't matter, whatever they want to call it. So I would put them on a maintenance dose, a low dose, and I would add one of my growth hormone building peptides, right? Why? Because I know at this point, they're still going to burn fat. They're going to regulate their insulin and they're going to build their muscle. And most people do much better on that. I think when people are invested in having 2, 3 peptides or more, you don't get bad results. You always get great results, and they have minimum side effects. And more than ever, that's why I wanted to have that history, because when people talk about peptides, they think about all the ones that Joe Rogan talks about or whatever the other guy. These are not, bioregulators are amazing because there is a track record and over 100 years of history in Russia where they gave it to all their soldiers, right? And their workers in whatever Chernobyl and those, welding factories that they were just like poor health conditions and they fixed their longevity. Like, what else do you want to do? Like, they fixed their organs. So because their organs were dying, they came up with these bioregulators, which is peptides, fancy name. But I like the ones that are made of the organs. They're made of porcine. So Dr. Halasa, you're going to have them, right? But also they're made of calf. But there's also the synthetic ones. Does that make sense?
Yeah, totally. It's a great type of protocol system you use with the testing and then lifestyle maintenance and improvement, and then go to the peptides.
Reduce the inflammation, chronic disease. Then you amplify by giving them something like icing on the cake.
Okay, and then you have many different sources for these, or do you tend to go to one?
Yeah, no. So I have a pharmacy that still can compound some stuff there in Carolina, and that's the liquid one. I can get from her some BPC. I cannot share her because supposedly she's a secret. But TB4, I can GHK and BPC. I usually get that and thymosin alpha from her and PT141. I didn't talk about sex peptides either. Like the PT141 is a really cool one peptide. The other is Trevor Biomedical something. He's a manufacturer. So he's a manufacturing facility. He has certificate of analysis, but that's going to be shut down because that was a quick buck. Other source, I mean, some people are doing sermorelin and epimorelin. That's, I think, Mike, this is still okay with regulations, right?
Yeah, go ahead, but as long as you don't mention any name of the company, you can go ahead.
No.
And then Are we done? Are we done from the CME? We can close and then we can talk freely.
Yeah, I thought we were done. I mean, am
Okay.
I too early?
Can we
Yeah.
start the recording and then we can go ahead and talk?